Welcome to The Explainer. Today we're going to uncover the story behind a really common but super misunderstood condition. And we'll talk about the quiet pioneer who completely changed how it's treated, helping millions of people finally get a good night's sleep.
Okay, so let's dive right in. In the medical world, and especially in Turkey, right? The name Dr. Hulusi Behçet is huge, a total legend. He literally gave his name to Behçet's disease. But what if I told you there was another Turkish scientist whose work was just as impactful and is a saving grace for millions every single night?
Well, this is the story of that scientist. And it's also the story of the medical mystery he dedicated his life to solving, a condition known as Restless Legs Syndrome, or RLS.
So, before we get into the really strange symptoms of RLS, let's first get to know the man who would change everything for the people suffering from it.
You can see Dr. Akpınar had this incredible, distinguished career, spanning decades, even continents. But it was that one publication, right there in 1985, that would cement his legacy in the world of neurology forever.
Okay, so what exactly is this condition that Dr. Akpınar was so focused on? Well, it's a neurological disorder that, for a lot of people, basically turns the simple act of resting into an absolute nightly battle.
You know, so many people suffer for years and years because the sensations are just bizarre. They're really hard to describe. People often think it's a circulation problem, or maybe rheumatism, but the feeling is completely neurological.
Yeah, it's not just like you're fidgety. Imagine trying to fall asleep, but you get this deep, uncomfortable feeling in your legs, a feeling that absolutely screams at you to get up and walk around. And that's the reality for someone with RLS, whether they're in bed, on a long bus ride, or even just trying to enjoy a movie.
And this is the frustrating, just maddening cycle that so many patients go through every single night. You lie down, the weird feeling starts, you have to get up and pace the room, you finally feel some relief, you go back to bed, and then boom, it starts all over again. It leads to this chronic, really debilitating lack of sleep.
So, what in the world is causing the strange neurological condition? For the longest time, it was a total mystery. But now, science is pointing to a couple of main suspects inside our own bodies.
The first big clue. It's tied to something super common, a mineral that's essential for our blood and our brains: iron.
So the idea is that for some people, their brain just has a hard time grabbing the iron it needs, even if their blood levels look okay. This is a huge deal for women, and it's why RLS can really flare up during pregnancy. And that's why, for any patient, an iron test is absolutely step number one. Sometimes, believe it or not, that's the whole fix.
Now, the second suspect, and this one is arguably the most important, involves this really powerful chemical messenger in your brain. You've almost certainly heard of it. It's called dopamine.
Yeah, dopamine is basically the chemical that helps control your muscle movements. With RLS, it's not that you're out of dopamine, it's that the whole system that uses it gets a little wonky, especially at night. And this is where Dr. Akpınar comes right back into the story.
See, Dr. Akpınar made this absolutely brilliant connection. As a neurologist, he knew that a problem with dopamine was also the main issue in another, much more famous neurological disorder. He was thinking about Parkinson's disease. Now, they're totally different conditions, right? But he knew Parkinson's is treated with drugs that give the brain's dopamine system a boost. And that sparked a revolutionary idea.
Dr. Akpınar must have asked himself this simple but really profound question. If RLS is also related to a problem in the dopamine pathway, could the same type of drug bring relief?
And then it happened. 1985. Dr. Şevket Akpınar published his groundbreaking findings. He reported to the scientific world that levodopa, one of the main drugs for Parkinson's, was also a super effective treatment for restless leg syndrome. He had found the key.
Now, at first, this caused a bit of confusion, as you can imagine. Patients would get a prescription for a Parkinson's drug, and, they'd naturally get worried. But the logic was perfect. It wasn't about treating the same disease. It was about targeting the same underlying chemistry in the brain.
So, let's fast forward. What does Dr. Akpınar's big discovery from all those years ago mean for people who have RLS today?
It's pretty simple, actually. His breakthrough isn't just some old story in a medical textbook. Nope. To this day, neurologists all over the world still follow the fundamental treatment path that he carved out. His work is still the first thing they turn to.
And the big takeaway here is that if you're one of those people suffering night after night, there is a clear path to relief. RLS is a very, very treatable condition, But it all starts with seeing the right specialist, a neurologist, to get an accurate diagnosis, instead of suffering for years thinking it's something else.
When you think about it, for a condition that causes so much hidden distress and just wrecks your sleep, it's vital to know that effective help is out there. And that relief is a direct result of the pioneering work of one very inquisitive doctor.
And that kind of leaves us with one last thought, doesn't it? The world rightly celebrates famous names in medicine like Dr. Behçet, and they absolutely should. But Dr. Şevket Akpınar's story is this powerful reminder to also look for the unsung heroes of science, whose quiet discoveries have a massive impact on our daily lives.